Hello, I am Dr. Jennifer M. Jones. Welcome to today's presentation on psychotropic induced endocrine dysfunction. I appreciate your participation and thank you for coming. Throughout your education and as first year psychiatry students, you are going to get an in-depth look into the mechanisms of action related to psychotropic medication, specifically on how those medications might adversely affect your patients. So let's begin by looking at what a psychotropic is exactly. In the simplest definition, a psychotropic is a drug that affects a person's mental state as well as mood, thoughts, behaviors, and perceptions. So, for the sake of our discussion, we will be focusing on prescribed psychotropic drugs that induce endocrine dysfunction. In general, psychotropic medication is prescribed to keep patients well. Psychotropics work by adjusting levels of brain chemicals or neurotransmitters, more commonly known, like dopamine, aminobutyric acid, GABA, norepinephrine, and serotonin. There are 5 major classes of psychotropics. Number 1, anti-anxiety agents. 2, antidepressants. 3, antipsychotics. 4, mood stabilizers. And 5, stimulants. A more extensive breakdown with medications can be seen in the slides. So, of these categories, some can cause serious side effects and have special monitoring requirements. It is your responsibility to know how to identify the side effects and monitoring requirements so that you can educate your patients and their families, keeping the patients as safe as possible during the treatment process. Psychotropic medications treat mental illness such as anxiety, depression, schizophrenia, bipolar disorder, and sleep disorders. This is not an exhaustive list. You will want to familiarize yourself with other disorders. So now that we have defined what psychotropics are, let's take a look at what makes up the endocrine system. Please turn your attention to the body slide. Males and females share all of the same endocrine glands besides the reproductive organs. The primary function of the reproductive organs is to create and release gametes. They also release a number of hormones which affect the body in different ways. There are several structures that make up the endocrine system that are located in various locations of the body, 8 of which we'll discuss here today, the primary 8. First, let's take a look at the pineal gland, which is activated by neurons connected to your eyes. When the nerves are activated by light, the pineal gland is repressed. During the night hours, there's a decrease in the amount of light that reaches your eyes. This is when the pineal gland is activated. The pineal gland secretes melatonin, a hormone that activates the sleep cycle, changing your respiratory rate, brain patterns, and digestive patterns, helping your body to coordinate for sleeping. Thyroid gland secretes several hormones that act on metabolism, decreasing or increasing cellular metabolism. The pituitary signals the thyroid, instructs it on which hormone to release. Parathyroid gland secretes chemicals that allow for normal bone development. The hypothalamus, located in the brain, releases crucial chemicals that influence the body's homeostasis, and the pituitary gland. Oxytocin and growth hormone are 2 of the many chemicals. The pituitary gland, in addition to signaling and instructing the thyroid gland, it releases hormones related to growth, mental development, and sexual reproduction. The thymus regulates T cell production, which is extremely important in the development of immune health during childhood. In post-pubescent children, this is phased out. The pancreas releases insulin in the body, allowing for sugar in the blood to be metabolized. The adrenal glands secrete adrenaline hormone during fight or flight and influences the way our bodies use energy. Sex organs such as ovaries in women create estrogen and progesterone derivatives that help sexual development as well as aiding in the release of eggs for future fertilization. All of these systems work together to keep us alive and are vulnerable when drugs are introduced into the system. So, what is psychotropic induced endocrine dysfunction? I'm glad you asked. So, in the case of drug induced endocrine dysfunction, drugs can cause endocrine dysfunction by direct alteration of hormone production, changes in regulation of the feedback axis, on hormonal transport, by disrupting binding and signaling, as well as changes that would counter regulatory hormone systems. In addition, the endocrine abnormalities can mimic a variety of other disease states, so it is imperative for prescribing practitioners to recognize drug-induced hormonal metabolic abnormalities and apply timely interventions. So, following, I'm going to discuss a list of possible psychotropic-induced endocrine dysfunctions. The pituitary dysfunction, hypoprolactinemia, thyroid abnormalities, calcium and vitamin D dysregulation, osteoporosis, obesity, diabetes, dyslipidemia, adrenal dysfunction, drug-induced fetal crisis, amenorrhea, hyperandrogenemia, PCOS, infertility, and sperm abnormalities. Now, see, all of these items that I just mentioned are endocrine dysfunctions that can happen as a result of psychotropic medication use. And some of the specific psychotropic medications, like for pituitary dysfunction, for example, opioid medications or immune checkpoint inhibitors could have been ingested by the patient. So for hyperprolactinemia, for example, psychotropics and opioids could be the cause. For thyroid abnormalities, we're talking about hyperthyroidism or hypothyroidism. Opioids or psychotropics again. And these things are not exhaustive. So you want to make sure to familiarize yourself. I'm just giving you a brief overview. And so osteoporosis, for example, opioids and psychotropics again, or corticosteroids, obesity, psychotropics again, or anti-epileptics. And so we could go on and talk about a variety of different medications that could cause these items. But again, you want to familiarize yourself with these things. So, in conclusion, knowing your role and addressing the problem. So be aware that drugs can cause endocrine abnormalities via different mechanisms and mimic a variety of clinical scenarios. Promptly recognize drug-induced hormonal and metabolic abnormalities. Provide timely care to address drug-induced abnormalities. And you also want to avoid the challenges as much as possible by knowing the mechanisms of action regarding the drugs and medications that you will be prescribing. You will also want to take a thorough patient history and treat each patient individually according to their specific needs. And you will also want to collaborate with an endocrinologist and other specialists on the team. You know, all of your team members, you want to provide the best possible care to your patients, and you do that by working in a team and as a team effort. So now we will have a brief question and answer period. And please note that none of the information presented here today is any new information. It is data that I've gathered and presented directly from my references listed on the reference slide. So thank you for your time and participation in today's presentation on the topic of psychotropic-induced endocrine dysfunction. Again, I am your presenter, Dr. Jennifer M. Jones. Everyone be well.